to this live webinar in which we're going to discuss the importance of the COVID-19 vaccine, specifically in 18 to 40-year-olds. And I just wanted to go through some housekeeping before I introduce our guests and our panelists. The first thing to say is we are going to be recording this event, and we will make it available in case people join late or wanted to go back and revisit it. We will make it available on YouTube. And the other thing I wanted to say is we're very keen to have interaction and discussion this evening. So please do feel free to put any concerns, any questions, any queries in the chat of the chat function of the Teams, but you won't be able to raise your hand or unmute yourself. So you will have to put all your questions through in the chat, and please do feel free to put them forward. They're the main housekeeping issues. And the other thing I just wanted to emphasize is that we did ask for your name and email address for registration, but these won't be shared with anyone beyond this evening. It was just for the ability to allow us to enable you to join as registered participants. So none of the data will be shared. And if you have any concerns about that, please feel free to email info@baps uk.baps.org, and any concerns that you have will be answered. Okay, so I guess we should start. And the first thing I wanted to say is just very briefly tell you about the panel of experts that we have with us this evening. We're joined by Dr. Bharat Pankhania. I'll give you a more detailed introduction of Dr. Pankhania later on, just before he gives his talk. He's from the University of Exeter. Very grateful to him for joining us and giving up his time this evening. Thank you, Bharat Bhai. We're also joined by Dr. Gayatri Amirthalingam. She's a consultant in Public Health England, consultant in epidemiology at Public Health England. Again, an expert, especially in vaccines. So very grateful to you, Gayatri, for joining us this evening. Thank you very much for giving up your time. And also, last but not least, we have a member of our BAPS healthcare team, a very active member of the team, Dr. Nirav Amin. He's a general practitioner and partner at the Station Road Surgery in Bromley, but he's importantly leading acute COVID clinics in Bromley. So a very experienced panel with us this evening. We're very fortunate to have them with us. So please do ask lots of questions, because I think it's going to be a great opportunity. Okay, so to start off with, what we wanted to do is show a video that BAPS has created just to try and summarize why it's important for the younger population to take up the COVID vaccine. There may be some doubts in people's minds as to why it's important for the younger population, and we're hoping that this video will provide a little bit of information and a little bit of background to this whole webinar. So we'll have a look at the video and then we'll move on with the program. Thanks very much.
We all know the COVID-19 vaccine is now being offered to all adults aged 18 and above. But why do young people need the vaccine when they don't get serious infection, and so few need hospital admission? It's simple. If we want to get any sense of normality back in our lives, then it is critical that all adults, no matter what their age, have the vaccine. For travel abroad, whether for work or holiday, evidence of vaccination is very likely to be mandated. Sports events and social gatherings will also only return to pre-pandemic numbers if we are vaccinated. Even though young people may not get severe or serious infection, they harbour infection without any symptoms and are the main spreaders of the virus. We all need to have the vaccine if we want the virus to stop spreading. If we don't get vaccinated, the virus will spread for longer and result in more mutations and variants, such as the current Delta variant, which will also prevent life returning to normal. Worryingly, the newer strains are affecting young people more severely and resulting in many more being admitted to the ICU or even dying of the infection. If the young do get COVID-19 infection, they are at much higher risk of developing the long-term consequences and disability. Long COVID is much more common in the young. It is simple. Vaccination is the only way we can get back to normal in all walks of life and allow the economy to recover faster. For people of Black, Asian, and minority ethnicities, no matter what the age, the risk of COVID-19 infection is much higher. So even if you are young, if you are of Indian or South Asian ethnicity, you should get the vaccine to protect yourself.
If you now realise exactly how important the vaccine is for the young, it's understandable if you have some concerns about the potential side effects. There's been plenty of scaremongering stories in the media which has made us question its safety in the young, but it's really important that we understand the evidence and listen to the facts before making a decision for ourselves. One of the main concerns is whether the vaccine is associated with blood clots. Now, this is something that was never actually proven, and in fact, you have a 16% higher chance of developing a blood clot after the infection than after any vaccine. But to minimize any risk, no one under the age of 40 will be offered the AstraZeneca vaccine. Many may also believe that you don't need the vaccine if you've already had the infection because of natural immunity, but your levels of immunity can't be guaranteed, and in any case, the vaccine will only act to further boost your immunity. Another thing that often worries people is whether the vaccine will affect their ability to have children in the future, but many women involved in the COVID-19 vaccination trials have now gone on to have healthy babies. In fact, there's now good evidence to suggest that it is completely safe to have the vaccine at any stage of your pregnancy. And actually, it's much more dangerous for both you and your baby if you were to be infected with the virus over the course of your pregnancy. It's also completely safe for you to have the vaccine while you're breastfeeding. You can have the vaccine and then continue doing so. All adults are now invited to have their COVID-19 vaccinations. Please book yours as soon as possible for both yourselves and the people around you.
So hope that was a helpful run through and a quick summary of the important reasons that we should be considering the vaccine, especially in younger people. Just to let our guests know, we've been showing this vaccine in our evening assemblies, which are online every evening for the last week, just to increase awareness, and as people sign up for the webinar, to let them know what we're going to be talking about today. So we have been showing them quite regularly, and again, this video has been uploaded onto YouTube as well. Okay, so for the next part of our program, I'm really delighted that we've been supported by Rakesh Patel, who is the founder of the official Indian cricket supporters group, the Bharat Army. This is a global Indian cricket supporters group, and the aim is that they allow Indian cricket fans across the globe to be able to go and watch the team play. And it's recognised by the global cricketers community as the largest supporters group in the world, with 1 million followers on social media. And Rakesh has been very kind enough to send us a video just to tell us about his support for the COVID vaccine. So we've got a short video from him just to sort of emphasize that how important it is to him, especially in the context of sport and getting back to normal. So we'll have a look at that video now.
Hi, my name is Rachi Patel and I'm the founder of the Indian Cricket Supporters Group, the Bharat Army. I'm a huge, passionate sports fan. I love my football and I love my cricket. And most recently, I spent up to 8 days watching live sport in stadiums. As I personally have type 2 diabetes, I felt it was absolutely paramount that I got myself protected. And so I made sure I got both jabs before I entered the stadium to make sure that I fully protected myself and I could continue doing the things I absolutely love to do. So my message out to all of those Asians out in the UK at the moment is please, please, please protect yourself, take those vaccines so you can all continue to do the things that you love to do, just like I did. Thank you.
So that was a nice short message, just emphasizing to everyone the importance of us getting back to normal and allowing us to get back to normal. We need to really think about taking the vaccine. So now I'm really, really delighted to welcome Dr. Bharat Bankania. He is Senior Clinical Lecturer at the University of Exeter. He qualified as a GP from the Welsh Nations School of Medicine in Cardiff and subsequently took further training in respiratory medicine, which is medicine for specialists that deal with lung conditions. He then trained in public health and infectious diseases, so has become a real expert in diseases that are communicated by infection. So he's now a senior consultant in communicable disease control, and the specific infections that he's worked on include the problems with influenza or flu, the Ebola virus. He's done a lot of work on that. He's done a lot of work on tuberculosis. And before this pandemic, we had this first SARS pandemic, and Bharat was also involved in controlling and dealing with that pandemic. So huge amount of experience in this, and some of you may have heard him and his excellent contributions on LBC radio as well. So really grateful for your time today, Bharat Bhai. Bharat Bhai is going to tell us about why all Hindus should be taking the COVID vaccine. Thanks very much, Bharat Bhai. Bharat Bhai, if you can just unmute yourself, sorry.
Namaste, namaste everyone. Thank you for giving me this platform, and it's my pleasure to take you through the journey. I want to take you through the journey of the vaccines and how they were developed and what the engineering is, what it does, how does it create the immunity, and why we feel it is an important thing to make use of it. So let me start. These are wonderful inventions, really, truly remarkable, that in less than a year, we were able to create vaccines against a coronavirus. So we've never had coronavirus vaccines for human beings. And in less than a year, not only did we have candidate proteins that were chosen for the SARS-CoV-2 virus, but we were able to create a platform and then create the vaccines, go through the trials and deploy them. It really is a marvel of science. And the marvel of science is that when all the gates are opened, amazing things happen. Gates, money, funding, and the desire to achieve something. All of these were lined up and we got a result. And this is something for us to bear in mind for the future, because I feel for a very long time we have been dragging our feet over issues such as a better vaccine for TB, a vaccine for malaria, a vaccine for dengue fever, and so many other therapeutics that we could lay our hands on. Vaccines for AMR, antimicrobial resistance. We're running out of antibiotics and we need to do something. And one of the things that we could do is, instead of just saying we've got no more antibiotics, is develop vaccines against these bacteria for which we are now running out of antibiotics. So let's start the journey. This is not old, this is not absolutely new, so new that we know nothing about it, technology. It has been tried with the Ebola vaccine that was manufactured in record time as well, but also it has been tried for other therapeutics. And so it isn't some absolutely novel idea. So the sticking block was how to deliver the messenger RNA. This is a compound. It is a compound with a specific instruction to something that resides in your cells, the ribosome. The ribosome makes these proteins. So the difficulty was, how do I get this messenger RNA into your cell for the ribosome to translate the instructions in the messenger RNA and make the spike proteins? So what happened is Pfizer-BioNTech came up with the idea of you make the compound, and the compound is the instructions, the messenger RNA, and that messenger RNA is coding for the manufacture of the spike proteins which are found on the surface of the SARS-CoV-2 virus. So the messenger RNA has to be delivered to your ribosome. How to do it? Well, Pfizer-BioNTech, and we must pay a lot of credit to BioNTech, a family couple from Turkey living in Germany, who had the novel idea of coating the messenger RNA compound in a nanoparticle, 10 to the minus 9. So tiny, 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 tiny particle, and it's coated in this lipid membrane. So it's a little bit like a, if you can visualize a golf ball. If you take the skin of the golf ball out, you come through rubber and then to the little ball inside. It's multi-layered. So the mRNA, Pfizer-BioNTech, Moderna vaccines are of that platform. It's coated in lipid. It's a nanoparticle, tiny, tiny, tiny particle. And what it is that the lipid allows you to go through a human cell membrane. So after it has been injected inside your arm, the lipid allows it to enter the human cells because it goes through the cell membranes. Once it has entered your cell, the lipid dissolves and then it just disintegrates, and then it releases the messenger RNA. That messenger RNA interacts with your ribosomes, and the ribosomes read the messenger RNA and do what the messenger RNA is asking it to do, which is manufacture spike proteins. Those spike proteins are pushed out, in other words, expressed on the cell, and your body's immune system now, your soldiers which are looking out for alien items, identify these spike proteins, recognize it as foreign, and make an immune response to it. And the immune response is twofold, well, threefold really. It alerts the cellular side of your immunity, the humoral side of your immune system, which is the antibodies, and finally it also makes immune memory. It's the immune memory that's very, very important, so that going forward 2-3 years from today, there is immune memory against those spike proteins. So that's how, in a nutshell, the Pfizer-Moderna ones work. The AstraZeneca-Oxford vaccine works in a similar way, slightly different. So what they've done there is they use a primate adenovirus, primate meaning in a chimpanzee, adenovirus, and adenovirus is a common cold virus. They use that to carry the instructions to your nucleus. So a virus from a chimpanzee, and it's deliberately a chimpanzee one, so that you don't have previous antibodies against it, the adenovirus. So the adenovirus carries it into your cell, and then the instructions are to your nucleus to make the mRNA. And the nucleus makes the mRNA. The mRNA goes and finds the ribosome in your cell, cytoplasm, and it makes the spike protein, and then the rest is history. Now, what I want to emphasize to you all is neither platforms of these vaccines or any of those vaccines that have been authorized interfere with your own personal DNA. This is very, very important, because a lot of people are frightened at that these fancy new vaccines, mRNA, magic stuff, adenovirus carrying the instruction to make mRNA and all that is interfering with your DNA. Let me reassure you that it isn't. It does only one thing only. The Pfizer Moderna one gives you the mRNA, which makes the spike protein, which makes the immunity. The AstraZeneca Oxford brands, that's the Indian one, has got a different name to it. It asks your nucleus to make the mRNA to then make your ribosome make the spike protein. That's it. So you will also argue that how come it was developed so quickly? Well, the answer is all the gates, all the money was made available. So it goes through rigid quality control measures. It's well determined, meaning there are international protocols for a vaccine to go through several stages: 0, phase 1, phase 2, phase 3, and there is external scrutiny of the data. And as it goes through the process, the data is also examined, and finally by external scrutineers and external countries which are going to buy the vaccines, look at the data, etc., and say, here is an effect. If I immunize you, it appears to produce immunity and protection from getting infected. So I again want to reassure you, I want to make you feel comfortable that just because they were invented in less than 12 months, it doesn't mean corners were cut. All that is that lots and lots of money and lots of gates were all opened up to find a vaccine that works. Nothing else. No shortcuts, no fudging of the data, no fudging of the results. Now then, you will ask, well, if it was so clever, how come suddenly you came up with this association with AstraZeneca, Oxford, and blood clots? My answer is as follows. There are known knowns, to use the language of Donald Rumsfeld, who's just passed away. Right? There are known knowns, and then there are unknown unknowns. So with respect to the blood clots, it is so rare, it's so very, very rare, that you would only pick it up after you had given several million doses of the vaccine and then found a causal relationship between there is a potential for the generation of clots, very rare, very unusual, very unexpected, very idiosyncratic. And as soon as that link was established, the United Kingdom government, which is rich and affluent and has got lots of spare vaccines and lots of spare platform type vaccines to use, immediately said, we will give you the Pfizer or the Moderna one in the younger age group where the clots were occurring. I have to emphasize again on the subject of clots, it's more likely that you will get a clot if you smoke, if you take long distance flights, if you get COVID-19 disease. So compared to all of those items, the SARS-CoV-2 vaccine, AstraZeneca Oxford one, does cause clots, but it's very, very rare, very rare, very idiosyncratic, and we also know what to do with regards to looking out for it. So in a nutshell, these are the vaccines in use in the United Kingdom. Now then, finally, in my last run up to why we should take it. Well, looking after yourself is a multi-layered approach. And the multi-layered approach is avoid crowds, avoid getting close to other people, avoid closed, poorly ventilated places. And you wash your hands, you wear your mask. So these are all layers that I'm building up. And then finally, the other layer that I can give to you is the vaccine. And when you put all those layers of infection control together, the vaccine is protection layer number one. It really does protect, and it protects long term, because every now and then you can drop your guard with regards to being in crowds, being close to people, being in poorly ventilated places, etc. Whereas the guard, the vaccine that has given to you, is protecting you all the time, every time. And it is important to be immunized because, number one, a immunized person is unlikely or very rare for them to end up in intensive care unit, in ICU, requiring ventilator and dying. Okay, so that's one thing. It protects against severe disease. Secondly, a immunized person is less infectious. So you might get mild to moderate infection despite being immunized. However, you are less infectious. So if you think about it, you are fully immunized and you come home with your infection, you've got your elderly parents, your grandparents in the house, etc. You have put yourself in a better position by being less infectious towards your older people, more vulnerable people. And finally, there is the specter of long COVID. Long COVID basically means is after you have recovered from your infection, some people, not all people, some people, and the range is, we don't know, but it could be up to 15–20% of the people are left with this syndrome called long COVID, where it affects your heart, your kidneys, your gastrointestinal system, fatigue, tiredness, brain fog. And we don't know. We just don't know how long it's going to last, what to do, how to squash this autoimmune trigger that has been triggered in your body, which is now giving you heart, kidney, gastrointestinal, brain, fog, etc. problems. We don't know. So why do we want to enter unknown territory when there is something that you can have which will protect you? It won't protect you 100%, but it is the best protection there is. These are safe, they work, they've been given in millions of doses now, and they do the job. And it's no good you telling me, but I'm young, fit and healthy, I don't need these vaccines. We get young people infected, we get old people infected, we get people with long COVID. It is universal. And the one more thing that I really must emphasize is the poorer you are, the greater the risk of illness. And because you are exposed, you might be a taxi driver, a bus driver, a cleaner, a cook, a cashier, all those things where you meet a lot of humans all the time. You work very hard, you work hard in factories, you work in crowded places, you work at the airport. Those are all at-risk places, and it's poor people who are getting the brunt of it because that's where they work, that's where the low pay is. So you really need to say, I need to protect myself because of my circumstances. I live in a crowded place. I'm living in uncertain times. And finally, I say, and I say this to my medical students, this is a game of chess. Chess invented in India. So this is a long strategy game that you have to play. You keep yourself alive, you keep yourself well, you protect yourself, you immunize yourself, don't get infected, don't infect others, and don't get checkmate, because if you get checkmate and some of you get very severe illness, it could be dire consequences. So play that game of chess, play it slowly, carefully, meticulously. Better times will come. I promise you, better times will come. So I want you to hang on in there with your vaccine, and then better times will come. That's enough for me. Thank you.
Thank you so much, Dr. Pankania. Really nice to end on a positive note. I think that's what we all need. Really, really helpful. Thank you. We're going to move on to our second expert guest, and then we'll have the Q&A panel at the end. So again, hugely delighted and honoured to welcome Dr. Gayatri Amrithalingam. She's a consultant epidemiologist in the National Immunisation Team at Public Health England. Gayatri studied medicine at Imperial. She actually spent 4 years training in paediatrics, very close to my heart, Gayatri, so I'm very pleased you're here. And she trained in paediatric infectious diseases and then went into public health and has done a master's in public health. And her key areas of responsibility at Public Health England are exactly this. It's vaccines and preventable diseases. And for this pandemic, she's leading on evaluating and supporting the impact of the vaccine program on the COVID-19 pandemic. So hugely grateful to you, Gayatri. Thanks very much.
Thanks very much, Sejal, and good evening, everyone, and namaste. And it's a real pleasure to be able to participate this evening with you all. And very difficult to follow after Dr. Pankhani. I think he's really covered everything really nicely. But what I was going to do was just give you some of my thoughts about some of the key myths and misconceptions that I know are very much out there, particularly in social media. And try and help go through sort of 4 key areas during this sort of short session. So I think I can move on. So there are 4 key questions that I really wanted to cover. The first, which I think Dr. Pankhani has already talked about, but I just wanted to illustrate with some of the latest information on how effective these vaccines are, is really to tell you about, and I think we are really privileged in the UK that we have such amazing systems to monitor how effective these vaccines are. What do we know about the effectiveness and safety of the vaccines that are particularly used in the UK and in our programme? Talk a little bit about fertility. I thought the animation really highlighted some of the key messages, so I'll just talk a little bit more about the questions around fertility. And then move on to the questions that I know often are asked, particularly for women who are pregnant. I understand that there's obviously concerns about taking anything, any medicines, any vaccines while you're pregnant. So we want to sort of talk through what we know about vaccinating in pregnancy, and then end on something around breastfeeding as well. So I think the first thing to say is that there is really, really strong evidence that these vaccines save lives. We've already got huge amounts of information coming through from not only the UK, but globally on how impactful these vaccines are. And as you've already heard, we know that these vaccines not only protect yourself directly after being vaccinated, but as you already know, by vaccinating yourself, you are actually protecting others because there is less chance of you passing on the infection, whether it be to your family, but also protecting your wider community. And I think that's really important because many of you who are in the audience today are obviously on younger adults and feel that this may not be particularly severe in terms of consequences for yourself, but you do have a role to play in the wider community and really helping us get through this pandemic. And I just want to give you some information about how effective these vaccines are. These are incredibly effective vaccines. Even 1 dose in adults under 40, which I know is mainly the target audience here tonight, for both Pfizer and the Moderna vaccines, which are the vaccines that are recommended for this age group, are between 60 to 70% effective at preventing getting infection or disease. So really effective even with 1 dose. And the fact that these vaccines are so effective have really been demonstrated in the work that we've been doing in my role at Public Health England to say, well, how well have these vaccines worked in our population? And we can see that since the programme was introduced, and this is back from December last year, across the country, it's been estimated that just by the vaccination programme being rolled out across the population, we've prevented more than 46,000 people being taken into hospital. And we've prevented almost 30,000 deaths. And I think that's really important to remember, that there is clear evidence now how effective and how impactful these vaccines have been, that people having taken up these vaccines have really made a difference in terms of the outcomes for this pandemic. So whilst we know that these vaccines are really effective, I just want to emphasize the fact that 1 dose isn't enough. We really want to encourage people to come back for their 2nd dose. And the reason for that is that we know that giving that 2nd dose gives you that added protection. 2 doses of, for example, the Pfizer vaccine is more than 90% effective. And it also gives you longer term protection. So the purpose of that 2nd dose is not only to give you additional protection, but to protect you in the longer term. And why is this important? And I don't want to give you too much data, but I do think there are some important information that's coming out, particularly at the moment. And so this is just data that we produce each week at Public Health England, which shows you the number of confirmed cases of COVID across England. So this is for the whole country, and we divide it by the different age groups, and each line represents a different age group. So what you can see is that early on, so if you look at the week numbers, so week 2 basically represents right at the beginning of 2021. You could see we were in the midst of our second wave, and that was obviously why we had our lockdown. And you can see the impact of that lockdown. And as the vaccine program rolled out, case numbers across all the population came really right down. But let's look at the most recent period in those last few weeks as lockdown restrictions have eased. And with the spread of the Delta variant, and I think many of you will know that this variant we know spreads more rapidly, more easily between people. You can see that those case numbers are unfortunately in an upward trajectory, going up in the wrong direction. And if you look at which groups are being seen with the highest rates of disease, those green and grey bars reflect young adults. So the most disease now is occurring in young adults. And that's because obviously we know that these are the groups where mixing tends to be more common. And so we know that they spread the infection more commonly, but also these are the groups that haven't yet been completely benefiting from the vaccine program. So I think it really is important to bear in mind that we're not out of the woods yet. We are continuing to see increases in case activity, and we're particularly seeing it in your age group, in that younger adult age group. And this is the group that we really need to ensure are fully protected. And so just one more data slide, and I promise no more data, but this is just data on the uptake of the vaccine. So again, this is something that we monitor at Public Health England every week. What proportion of our population are getting vaccinated? And this is just the first dose of vaccine. Just to illustrate the fact that, as you know, we targeted those at highest risk of severe disease at the start of the programme. So those are the oldest adults, those over the age of 80. And then we worked our way down the population, now opening up to all of those adults over the age of 18. And you can see that in our oldest adults within the population, we've done really remarkably well. We're getting coverage over 90%. But let's look down to those under 40 in that grey line, and you can see that that trajectory is pretty disappointing in comparison to all of those other age groups. We're now, this is this week's data, so it got published just today, at 37% of 18 to 40-year-olds who've had one dose of vaccine. Now, we think there's about 31 million people in country in this age group, and we think there's about 11 million who've had their first dose of vaccine. So we're talking about 20 million adults between 18 and 40 who've yet to be benefiting from vaccine. And given the trajectory of the number of cases, I just want to really emphasize it is so important for us to get this pandemic in control that everyone who has not yet had that opportunity to please go and just go and get the vaccine, because we know that it can make a difference. Okay, so I'm going to move on to some of those key questions about safety and these other questions about fertility and pregnancy. So I think Dr. Pankhania has already talked about this, but it's really important to know that, you know, every medicine, whatever it is, can sometimes cause side effects, and vaccines are no different. And these vaccines have really been well tested. Whilst it was done in record time, we still went through all those rigorous trials with tens of thousands of people across the globe being vaccinated as part of those studies. And all of the data shows that these vaccines are incredibly safe, but they can cause side effects. Most commonly, they are very mild and they may last just a few days. We already heard about this extremely rare event that's been reported following the AstraZeneca vaccine with blood clots and this pattern of unusual bleeding. And, you know, the UK really took steps very rapidly when they started to see this signal, because we have very good systems in place to monitor this. And when we found that there was a slightly increased risk in these younger adults, albeit extremely rare, the decision was taken to offer adults under the age of 40, so those of you online today, either the Pfizer or the Moderna vaccine. So even though the risks is incredibly rare and the risk of getting blood clots from COVID infection is much higher, they still took the decision as out of pure precaution to offer Pfizer and Moderna for those younger adults. The other thing that you may have seen in the news in recent weeks are very rare reports, particularly coming out of the United States, of something called myocarditis with Pfizer and the Moderna vaccine. And this is basically describing a situation where you may have some swelling or inflammation of the heart muscle. The reports that have come out, again, are incredibly rare. They tend to occur in younger teenage and young adolescent males after their second dose of vaccine. And these have tended to be very mild symptoms so far when they've been monitoring them very closely, and tend to resolve without any significant long-term outcomes. So again, something that is being kept very close an eye on. But given the wealth of data on how well these vaccines work, the number of lives and hospitalizations they're preventing, these small risks are far outweighed by the benefits. Okay, so moving on to vaccines and fertility. And I know that there's a lot of myths out there in social media, and I think it's really important to state that really there is no evidence that these vaccines affect either male or female fertility. And you just need to think about what Dr. Pankhania said about how these vaccines actually work, because there's no biological plausible way that these vaccines can actually affect your fertility. And I think and it was very nicely said in the video earlier that actually even during those trials, those vaccine trials, although pregnant women were excluded from those trials, women actually went on to conceive during those vaccine trials, and they had normal outcomes from their pregnancies. So that in itself provides a lot of reassurance. And just thinking about how those mRNA, the Pfizer vaccines work, mRNA is something that is in our body, we use and we make all the time to make any protein. So this is normal part of our existence. And as we've already heard, the mRNA doesn't actually get incorporated into your DNA. So there's no sort of biological feasible mechanism by which these can affect fertility. And I think this is really important to try and dispel that myth. I think the other thing to mention is that the components of these vaccines are sort of come out of your body through your lymph nodes within days. So again, it's not something that stays in your body for a long period of time to cause any kind of long-term effects. I just wanted to touch on pregnancy because I think this is a really important issue. And I know a lot of women, those of you who are pregnant or planning to get pregnant, really have this as a key question, which is completely understandable. But I think we need to put this in context with what does it mean if you've got COVID infection when you're pregnant? Now, it's important to stress that the overall risk of getting COVID or the risk of severe COVID infection in pregnancy remains quite low. But we are seeing now good information coming through that if you were to get COVID at the end of your pregnancy in your third trimester, that women are more likely to go into labour early and deliver your babies early. And we do know that by delivering your babies early, there can be more serious complications for both you and your baby in those first few weeks and months of life. We also know that the risks from COVID are higher in those of us in ethnic minorities, so Black and Asian minorities, and they're more likely to get severe outcomes as well. And you yourself as the mother can also get more severe complications, not only your baby, by getting COVID in the later stages of pregnancy. And so it's because of those risks that we're really keen and encouraging women to take up the offer of vaccination. And now that we have this wealth of data, particularly from the United States, where more than 100,000 women have been vaccinated with Pfizer and Moderna, really good close monitoring of that in terms of outcomes and showing really no safety concerns in these women. And that gives us even more reassurance to really encourage women to take up this offer. The other thing I think is really important is to stress that these are not live vaccines, so they can't cause infection either to yourself or to your unborn baby. And so like other non-live vaccines, which are routinely recommended for pregnant women, so the whooping cough vaccine and the flu vaccine, we know these vaccines are really important and can prevent serious disease, both for you and your baby. So I would just encourage you to look at the wealth of really important and accurate information that's out there, both in terms of from ourselves at Public Health England, but there's also a lot of other information. There's a snapshot of the leaflet here that I've shown, which gives you and hopefully addresses a lot of the questions that you may have. So the final thing I wanted to touch on was around breastfeeding. And again, concerns that, somehow the mRNA or the part of the vaccines might come into the breast milk and therefore go into your baby. And again, really no evidence to show that there's any risks from actually receiving vaccines while you're breastfeeding. And studies have actually shown that the mRNA from those vaccines cannot travel into the breast milk. They're not found in breast milk. But what does travel into breast milk, and which is well recognized, is these antibodies, your body's defense against infection. I mean, this is one of the great benefits of breastfeeding, is that we know that the mum's protection can pass to the baby. And in the same way, if you get vaccinated, your antibodies can actually pass into your baby and protect them. So actually there's benefits, there's good reasons to actually get vaccinated, even if you're breastfeeding. So I just want to end by just reminding everyone that, you know, these vaccines have really been shown to protect lives, they save lives, and by vaccinating, you're not just protecting yourself, you're protecting your family and you're protecting the wider community. Okay, I'll end there. Thanks very much.
Amazing. Thanks very much, Gayatri. It's exactly what we needed, just to provide reassurance to our younger population. And I'm just really pleased you showed the graph. I know it, as you say, it's data, but actually uptake isn't as good as we'd like it to be in the under 40s. And I'm pleased you've shown that sort of up-to-date data, just to emphasize how important today's conversation really is. So now I guess we move on to the more interesting part of the evening. I can see the questions have been flooding in. I've had several questions, and I can direct this to both Dr. Pankhania and Gayatri, about the mixing of two different vaccines, so AZ and Pfizer. Any data on that and your thoughts on that? I think the question arises from the fact that some of the younger people have already had the AZ vaccine, and so what should they do about the second dose? That's the kind of very specific question. Dr. Pankhania, did you want to start with that? Oh, you're muted again, Dr. Pankhania, sorry. Yeah.
I have been furiously typing away whilst Gayatri was giving her presentation and answering those questions, but happy to answer it again. So look, people have looked at mixing the different platforms, and in some cases, actually, the end immune response is actually better for having mixed it. And going forward, I can visualize that there may be a mixing of platforms. And what I mean by platforms is Pfizer is a platform where the nanoparticle takes in the mRNA into your body, and then the AstraZeneca one is a virus that is takes in the mRNA code, which then makes the mRNA and then makes the spike proteins. And mixing has been found to work, and it's okay. So I think going forward, if you think about it logically, yeah, the reason why the chimpanzee adenovirus was chosen was because you were unlikely to have encountered it, and therefore unlikely to have antibodies against it. So theoretically, technically, you could say when you've had two encounters with the adenovirus, you may make some immunity against the chimp adenovirus as well, therefore rendering the third, fourth, fifth, sixth jab, who knows which way we're going to go, of a AstraZeneca Oxford vaccine less effective. And there may come, who knows, we don't know, there may come a need to actually say you've had two of those, if you're going to have the third, fourth one, we need to swap it around and give you a different platform.
So no harm in...
Yeah, Gayatri will know a lot more as well.
Yeah, go for it, Gayatri. What did you think about that?
Yeah, so I think there's obviously a lot of discussion going on about what we should be doing, particularly for the booster program. And I think people will be aware that there is a plan for rolling out a booster vaccination program over the winter to protect particularly the most vulnerable. And as Dr. Pankhania said, there is now studies coming through which is suggesting that actually mixing vaccines may improve in terms of the immune response. But there's also, it's important to bear in mind that there is data, and we've actually published a study today which looks at this question about the reactogenicity or the reactions that happen after mixed schedules. And what it does look like is that by mixing schedules, you're more likely to get more reactions, side effects after mixed doses than if you had the same vaccine brand for both of your doses. And so you know, the current guidance in the UK is very much that if you had your first dose of AZ and you didn't have a specific reason, like an anaphylactic reaction, a particular severe reaction, or a clot, for example, a very rare event, then you should really complete with the same vaccine. And we know, for example, the AZ vaccine, you get more side effects with the dose 1 than dose 2. Now, Pfizer is slightly different because you tend to get more side effects with the second dose. But I know people sort of get the first dose of AZ and think we've had some side effects and we don't want to continue with dose 2. It's really important that they realise that actually the second dose is not going to cause as many side effects as the first. And also by switching, what we found in this study is that people who went on to have Pfizer actually had more reactions and more side effects by mixing schedules. So unless there's a clinical reason and your doctor is given specific advice for you to switch, the current guidance is stick with the same vaccine brand.
So as long as the first dose went safely, then carry on. That's great. That's really helpful. Gayatri, interesting question we've had about the impact of the vaccine on your menstrual cycle or hormones. Anything to say there?
So I think there's been a lot of, again, this is another one that seems to have a lot of attention, particularly because so the responsibility for monitoring any kind of side effects is with an organisation called the MHRA, and they monitor all sorts of effects that may happen after vaccination. And just bearing in mind that we've got pretty much most of the adult population who's received a vaccine, events are going to happen by coincidence. And menstrual disturbances in women is actually a relatively common occurrence in the general population. And if you think something like 30 million women have probably received a dose of vaccine, then getting tens of thousands of reports is probably not unexpected in the scheme of things. So really, this is something that has been looked at very closely by the MHRA, and there is no evidence that these vaccines have any impact on your menstrual cycle.
Great, that's really clear. Thanks very much. Nirav, I've had a question. Sorry,
I wanted to emphasize, you see, a lot of people are, concerned in many directions about my menstrual cycle, my fertility, my this, my that. And really what I want to emphasize is these wonder vaccines do one thing and nothing else. So they come in, they make spike protein, the mRNA is very quickly degraded and it's gone, as Gayatri said, your lymph glands pick it up, etc. But what I'm trying to say is these vaccines do one thing, make spike protein, the end, finished. They're not live vaccines. They're not going to reproduce. They're not going to make more virus particles. They're not going to do anything like that. So they do one thing only, make spike protein, the end.
Yes, that's great. That's really helpful. Nirav, I've had a question about are the vaccines animal product free, and also that it seems like several of our viewers quite like their GP. Can they have it with their GP, or do they have to go to a special NHS vaccine clinic? Just if you can unmute yourself. Yeah.
I think can you hear me now?
Yeah, that's great. Thanks. Yeah.
Hi.
Oh, you've just muted yourself again.
Sorry, a bit of a delay on that. So yes, you can have your vaccine with your GP. Certain GPs have signed up to giving both vaccines. For delivery reasons and storage reasons, the Pfizer vaccine is a little bit more tricky to handle and store in normal GP surgeries. However, that has been updated more recently, and we will be seeing more Pfizer vaccines and being present in general practice. The AstraZeneca vaccine has already been used and rolled out across general practice. Many general practice surgeries have formed together in groups called PCNs, and that may include 4 or 5 different surgeries who come together and maybe hire a hall and deliver it at scale to a local population of maybe 40 or 50,000 patients, rather than everybody pitching up and trying to do the same thing 5 times over. So you might find that when you speak to your GP or you are invited, they may say, go to a hall down the road, but that's actually run and organized through your GP surgery and a group of them. But absolutely, you can get it through them. The other way you can get it, of course, the national program, and you are eligible to sign up to those. It is available through the NHS website, and anybody can register for that. You just have to sign up and find your local centre. If you are eligible, you can just go up and sign up and turn up.
Great. And in terms of the sort of content and animal products or anything like that, anything to be concerned about there?
Absolutely. Sorry, I missed that part of the question. Yes, there is no animal parts or contents in either of the vaccines. They are suitable for vegetarians, and there is no animal components in either of the vaccines. So they are very safe, not just for Hindus, but for all vegetarians and other religions have all supported the use of these vaccines. So I would say it's very safe to do so.
Great. Gayatri, can I ask you, there's a question about alternatives to vaccines. Can you hear me? Sorry. There's a question about alternatives to vaccines being trialed, like ivermectin. Do you know, is there anything there that we should be discussing?
I mean, I think there are alternatives that are being considered in terms of, well, not necessarily alternatives, but people who may not respond as well because they've got underlying problems with their immune system and may not benefit to the same extent that others may benefit from vaccination. And so for those who may therefore require some additional sort of support, there are things that are being looked at in terms of things like monoclonal antibodies and treatments like that. To try and either as prevent them to get infection, but if they do, then reduce the risk of them getting severe outcomes. But there isn't really a substitute for vaccines. I mean, vaccines are something that can be used in the entire population at scale, as we've seen and demonstrated. And so really, you know, you might be considering in specific populations, specific groups who are at high risk, who don't respond in very, very small numbers. But at scale, you can't, I wouldn't envisage anything being seen apart from the fact that newer generation, new technologies of vaccines may be developed in the future. But I think vaccines are here to stay because we've shown how well they work.
And I guess just Dr. Pankania, can you just reassure us that the response to the vaccine is as good in the younger population as the older population, sort of regardless of age, you're likely to build an immune response?
Oh, absolutely. Just before I say this, I just wanted to add to what Gayatri has said in answer to that question about alternative therapeutics. So whilst we've got the vaccine branch has developed the vaccines and they're being deployed, there is another branch furiously at work in developing pharmaceuticals which may potentially block some of the essential enzymes or receptors or something on the coronavirus. And if it works, we will have something that we can give to you. And I think thinking empirically, it would be take at the first sign of trouble. So it would be something like oseltamivir, which is Tamiflu, which is a neuroamidase blocker, which basically, if given early enough in your influenza infection, can reduce the level of infection and just save you a couple of days of illness, that sort of level of thing. But who knows? Who knows?
Yeah.
There are people working on it. So in answer to your question about, are vaccines immunogenic in the younger age group? Of course they are. In fact, more so than in older people whose body is old and has got other problems, etc. So who is going to be more immunogenic? Younger people. Who is going to be less immunogenic? Older people.
Yeah, so that's reassuring. There's a very specific question about patients who've had a bone marrow transplant. I think that, again, there's anxiety around people who might be a little bit suppressed with their immune system. Can they have the vaccine? And if so, is there a time after transplant that's safe or anything like that? Gayatri?
So, I mean, this goes back to the fact that these aren't live vaccines. And so really, these are the groups that really should be vaccinated. These are our highest priority groups, actually. And so we would definitely encourage all of these people to be at the front of the queue to get vaccinated. So no, there is no reason in terms of safety concerns that people should be worried about. They should definitely get the vaccine and they shouldn't worry about it, but they should speak to their specialist and their GP if they do have further questions, but no reason that they shouldn't get the vaccine.
That's
quite to the contrary.
It really helps.
I think Gayatri is absolutely spot on, which is, look, these are not live vaccines or anything like that. So in the olden days, if you were immune suppressed, we would be concerned about giving you a live attenuated vaccine. But this is not one of those vaccines. It only does make spike protein. That's all. Okay, so it's not live. It's not even a virus. It's just a instruction, and therefore somebody who's immune suppressed, like with a bone marrow transplant or transplant patient, etc., they are top priority to protect themselves by being immunized.
That's great. That's really clear. There's a question around, I guess we're all anticipating opening up and perhaps traveling again. Is there an issue with having the COVID vaccine and the travel vaccines that are mandated? Would there be a problem with different vaccines being taken?
No, you protect yourself. You protect yourself fully. I mean, you're talking to me who has been in the immunization business as a GP and a community medical officer in pediatrics, etc. Vaccines save lives.
Yeah,
they prevent illness and they protect you. And 50% of us would not be here were it not for the vaccines. So if you're going to travel, you make sure that you are up to date with all your vaccines and you take your anti-malarials with you and make sure that you are COVID immunized as well.
That's perfect. That's a really important message. There's just because we started 5 minutes late, so I'm allowing us to go over a little bit. Just for all three of you, really, I've had a question about your thoughts about our behaviours following the relaxation of the rules proposed on Monday. I think we've got the message loud and clear that we should get the vaccine, but how should we be behaving from Monday onwards? Dr. Pankhania, did you want to start with that?
Yeah, look, I'll share with you all what I did this afternoon. And I worked it out that the Delta variant is much more infectious than the wild virus that we were first dealing with. In view of the fact that it is much more infectious and I have been fully immunized, I decided I'm going to up my infection control measures from the normal surgical masks that we're wearing to buying a better quality mask. So I put in the order on my desk for 10 FFP2 masks, which is better fitting, tighter fitting. And I just feel, this is my own thoughts, this is not government guidelines, but I personally feel if I can, why shouldn't I better protect myself? And other countries are doing that with a higher quality mask. Because remember I said, this is a game of chess. We've got to remain alive, don't get checkmate, and better times will come. So what do I say? Please wear your mask, but wear it properly. If you can, up your specification on the mask. I have personally upped it to FFP2, and I say, don't get infected. Don't infect others. Get yourself immunized. Better times will come.
Excellent, really clear. Thanks, Gayatri.
Yeah, I mean, I think hopefully showing some of the latest information, you can see that as we've been releasing, the measures, that we're seeing those cases going up. So they're going in the wrong direction. So I think it's really important that although, the direction of travel is to release restrictions, this virus has not gone away. It's still here with a vengeance, and people need to remember that. And I think they just need to be sensible and act accordingly, in the way that we have been doing up till now, in terms of, when you're in crowded spaces, when you're in enclosed places, then just think about, the risks, ventilate, make sure you try and still keep social distancing, wear your mask. Those things I think really do make a difference. Obviously, you've got the added protection of vaccine, but those things still add value, and it's really important that you continue to do those. And I certainly will be doing that beyond the 19th of July.
That's really helpful to know. Nirav, what do you think?
I agree with what both of you guys have said, but one thing that I would add is something that I see so commonly, which is people wear face masks, and as soon as they come into my clinic room, they pull it down as if I have a bubble around me. And I know that they do this with their families. They wear it on the street, and then as soon as they go into an enclosed space, they take it down, or just so they can speak more clearly, they lower it down, and all you're doing is just opening yourself back up again to infection. So if you're going to wear it properly. There's no point keep touching it and open your nose up and making your cheek and your chin have a face mask, but not your face.
That's really helpful. So very clear messages. I think we're all agreed on the benefits of vaccines and keeping ourselves safe. So we are now at time, and really huge thank you to both Gayatri and Bharat. Really grateful for your time. I appreciate how late it is and you are doing this in your own time, so cannot thank you enough. Would like to invite you both to visit the Neasden Temple when possible, and it is slowly opening up, and we'd love to have you there to visit the temple, and that would be great. I don't know if you've been, Gayatri, but I'd love to show you around there. Dr. Pankania, did you want to say something?
Yeah, I just remembered. So sorry to interject. I've been to your temple many times with my wife and children.
Oh, great.
But really,
Excellent.
one thing I really wanted to say, and I've completely forgotten, is I have been cooking. I have been cooking food here in West Country, in Bath, where I live, for poor people. And then I engaged a chef to cook, and we raised money. And that money that we've raised is, by the way, earmarked for the Swami Narayan temple.
Oh, excellent.
I'm just finalizing, the money raised by cooking. And
Perfect.
there's a few £1,000s finding its way to the Swami Narayan temple. I will talk to you personally and find out how I can make that money transfer. But
that would be great.
It is with the good wishes of the people of Bath. I told them what we were doing. I sent them to your website, and we've collected this money, and it's coming your way.
Great. Excellent. We'll put that towards the India COVID appeal. That would be amazing. Thank you, Dr. Pankania. And Gayatri, you're very warmly welcome to the temple. I'll be in touch with an invitation. So I hope everybody has enjoyed the webinar today. If you have, we'd be grateful for your feedback in the chat, because we do want to carry on running these types of events for sort of targeted populations. And as I mentioned at the beginning, we have recorded the session, and we will be putting it on our sort of YouTube channel as well for all to look through, because we've had some amazing information this evening. Just want to end up with a slide that just tells the audience what to do if they want to get the vaccine. There are 2 QR codes that allow you to work out exactly how you get the vaccine from the NHS and all the clinics that are available. I hope they'll be coming up soon. But other than that, we're all done. Thank you all very, very much. Really grateful for your time. Thank you. Should be having the slide coming up, I hope. So that's a very easy slide. You can scan the QR codes or visit the NHS website or book online by dial 119. So please, I hope we've encouraged everybody to take up the vaccine after today. Thanks very much, everybody. Thanks.